calling from a 914 area code. Who's this? Where are you calling from?
Hey there. Hi, this is Miranda Mitchell, also known as Rue McGuire online.
Hi,
I'm
Miranda.
From Georgia. Hey, Emma, how are you?
I'm doing well. We had corresponded before. You're a great follow. You wanted to call in to talk a little bit about Gaza and health issues there. If that's still what you'd like to discuss, go ahead.
Yeah, definitely. Yeah, thank you so much for the follow back. I've been a big fan of yours and Sam's for quite some time. But yeah, I have been interested in, your audience may be familiar with my boyfriend, Ettinger Mentum, Josh
Yes.
Cohen on Twitter, and also on Substack.
Legend, yes.
Yes, he's great. He's a really good politics writer, and I believe was on your show recently.
Mm-hmm.
And we've been together for a while, and I'm currently working on an article for him on the situation with polio in Gaza, which really brings forth once again the need for an immediate ceasefire. The fact that there has been one confirmed polio virus case as of July in Gaza Strip in a 10-year-old child, and I was just reading today about how WHO and UNICEF and the Palestinian Health Authority, the Health Ministry, I believe it's called, is hoping to start their vaccination program at the end of August, but that is simply just not going to be able to happen if there is not a immediate ceasefire.
Thank you for that information. Can you talk a little bit about what polio could bring to the people of Gaza if it's in one child and found in one child, the effects of that, and how that could spread?
Yeah, absolutely. Yeah. So some background a little bit. I have a master's in public health. I work for the state. I work for the U.S. Centers for Disease Control and Prevention. This is not related to my post. This is as a personal individual who is concerned about this. But yeah, it's incredibly concerning, and it's something that public health scientists like myself, epidemiologists, have been warning about for 10 months, that this is something that could plausibly happen after October 7th because of the complete destruction of the hospital systems in Gaza Strip. And what this means, so basically what happened in July was, and apologies if this is information that you and your audience might already know, but in July, in environmental samples, it was found that, polio virus, the type 2, the variant type 2 of polio virus was found in the wastewater systems in 6 different locations in Gaza Strip, including Khan Yunis, and I think it was Deir I'm not sure the name of the other area, but 6 different locations. And then obviously, we found that there's been one case in a 10-year-old or 10-month-old child.
Oh.
And what this means, I mean, the implications are honestly very, very, very scary, very terrifying. I mean, as many people, as you all probably know, polio virus is extremely infectious. Children in particular are particularly susceptible to it. Prior to this case that was detected in July, there hadn't been polio in Gaza Strip for 25 years due to, a very aggressive vaccination campaign. But as a result of the, Israeli offensive on the Gaza Strip, the percentage of the population that is vaccinated has gone below 90%. With many children not able to get their second dose, which is actually probably one of the reasons why we saw this case occur, because if you do not receive your second dose of poliovirus, the inactivated poliovirus that is in the first part of the dose can mutate and evolve and infect. And so WHO, UNICEF, others, UNRWA, are very, very concerned about this and hoping to send, I think, 1.6 million vaccines into Gaza Strip. But to do that, they need to, have the cold chain equipment. They need to be able to bring it in through like the Israeli airport. I mean, it needs to be supported by the Israeli government to be able to get people vaccinated. And if children do not receive that second dose, then they're very much so susceptible to this type 2 variant. So,
well, even before October 7th, Israel was, I think, sabotaging the vaccination effort for COVID in Gaza. I may be misremembering, but I believe I remember the bombing of a COVID facility, airstrikes in 2021 on Gaza's only lab for processing COVID tests. So they're very much in favor of bioweapons, essentially, or using disease as a weapon of genocide. This is, polio, devastating consequences, specifically for children. Paralysis, right, Miranda?
Yep.
Could this result in death on its own as well, or exacerbate things that could lead to death for children?
Oh, absolutely. Absolutely. It can. Death is pretty rare, but, polio, when you have severe polio, the paralysis leads to, or the virus itself leads to paralysis, and it affects the muscles that help you breathe. So, yeah, definitely death is a possible outcome as a result.
Well, thank you for the update. Everybody should be on the lookout. Subscribe to Edinger Mentum's newsletter, and you can get Miranda's piece there once it's out. Really appreciate you taking the time to call today. Thanks so much.
Yeah, thanks so much, Emma. Thanks for having me, all.
All right. Have a good one.
Have a good one. Thanks. Bye.
Bye. Okay, with that,
bad call followed by good call. But it's a really important point, something that we mentioned last week, too, especially as we draw comparisons between Israel's current genocide in Gaza and the genocide of Native American populations. It's not just the bombs that are killing people. It's the displacement and the various forms of, starvation, disease that accompany displacement and accompany like a disruption of all infrastructure that are kind of being papered over in pursuit of just like making about the specifically and horrendously the bombs being dropped. But the footprint of death is way bigger. We should have at least some cultural understanding of what smallpox did to the indigenous population in this country, and this is a modern version of using disease to kill for neo-colonialist projects. So
maybe it will just get the terrorists.
Maybe all the maybe the bioweapons will respect the. Well, I don't know. Just the human shield thing. Go ahead.
Pelosi, the whole Israel has a right to defend itself. Yeah. That phrase belongs next to Arbiat Makfry and some of the other most disgusting phrases in world history, in my opinion. Disgusting.
Well, Israel has a unique right to defend itself, is what the implicit understanding there. Like Israel and the United States of America, our vassal states, our sort of like expanded network of friends and allies are the only ones allowed to defend themselves. If you defend yourself from the state, from, antagonistic states, then you only have a right to die and also be slandered.
Yep.
And also, as Chris Hitchens says, Israel apparently has the right to defend itself without even needing to specify where exactly it thinks its borders begin and end, which is a nice position to be in.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.